Hi there, you're welcome to DamiRx Care channel where we talk about medications and how to use them properly. If this is your first time on our channel, make sure you hit the like and subscribe button down below. That way you can get alerts anytime we post our other educating videos and contents here on our YouTube. Also, you'll be able to support us here on our YouTube channel by hitting that like and subscribe button. And also, as a gift for you for subscribing to our channel, you can hit the link down below in order to download a free healthy meal recipe that we do have here on DamiRx Care. Thank you and bye-bye. So our medication of choice today is known as Hydrocortisone Cream. So Hydrocortisone Cream is one of my favorite cream for rash, or just in case if you have any breakout or a bee sting. This medication works wonders. And one of the great thing about this Hydrocortisone Cream is you can start to see the effect in about 1 to 2 days. That is one thing that I do like about Hydrocortisone Cream. So as you probably already know, this is a steroid cream that's used for a skin disorder. It's used for allergic reaction or a condition known as atopic dermatitis, which is a skin inflammation that do occur. It may be genetic, it may be like a family inherited disorder, or it can be used for a rash condition that just kind of happened. Maybe you ate something that you were allergic to and you just kind of see some breakout around your arm area or maybe around your leg. I personally used to get like a random rash in between my, it's called popliteal region scientifically, but behind my knees I used to get like some random rash. I don't know why, maybe because of sweat when I was much younger. So this medication was one of the medications that I would use, and I would literally start to see the effect in like 1 to 2 days. So this medication is a topical medication, meaning you want to apply it to just your skin. Also, one of the side effects of the medication, just in case your body doesn't react to it very well, you can get what they call the application site reaction, which is going to be like a redness or like an increased itching. So usually when this happens, your skin is probably irritated and is not able to take that hydrocortisone cream. So if this occur, you probably want to shift to more of a Benadryl cream, which would be like an antihistamine cream that can also be used for rash or allergy related skin condition as well. So what do you need to know about this medication? So you want to make sure that you're taking this medicated cream as directed. You don't want to apply it more than often because what it does is when you continuously apply it or you apply it for a very long time, it can kind of make that skin area thin. And this is for most likely patients who have been applying this cream for months or years. What it does, because it's a steroid cream, is it can kind of thin out that skin area or kind of cause what they call a striae, which will be like an stretch mark. So it can cause that stretch mark in that area because the area is a bit thin because you've been applying it for such a long time. So usually I would recommend patient only take this for a couple of days, kind of slow down, don't apply it. If it's gone, just you don't have to keep applying it after you don't see the rash. So I would recommend just applying for a couple of days till the rash is gone and just taking a break from it, and not just continuously take or apply the cream more than normal. Also, you want to make sure that you're washing your hands with soap and water before and after applying this cream on your skin. That way you're making sure that you're applying it with a clear hand, less germs to the application area that you're placing it. Also, you want to make sure you're most likely washing that area as well before applying that cream. That way there will be a good absorption into that skin area and it's able to work as it should. So this medication does come in cream and also in ointment. Depending on what area of your body, then you would go with the cream or the ointment. So let's say you start noticing the rash on your palm, then you want to make sure ointment on your palm. If it is going on your skin, then you want to make sure the cream is more beneficial in this area because it will be easily absorbed. But for the thicker areas of your body, you want to go with the ointment, or depending on which one you prefer, if it's the cream or the ointment, then you would go with whichever you prefer. But like I said, for thicker area of the skin, you want to go with the ointment. For thinner areas, we would usually recommend going with the cream. All right, so with this medication, you don't want to get it in your eyes, your nose, your mouth, or your pubic area, which is your vagina or your penis area. So you want to make sure you're avoiding this area, except specifically your doctor does prescribe it for that. Then that's when you want to apply it in this area. And also the medication comes in different strength. There's the 1% that's over the counter, and we also have the 2.5% that is behind the counter that you need a prescription for. So depending on which one, you want to make sure you're taking caution and applying it to the appropriate place, and making sure that it's not getting into the wrong area by washing your hands once you're done. Also, like I said, this medication, you don't want to apply it to a skin area that has a cut, a scrape, or a burn. You want to make sure that you're avoiding this area. If it gets into this area, you want to make sure that you're rinsing it off completely. That way it doesn't get absorbed. One major nasty side effect of steroid is if you're applying it to a wound or an area that is irritated, it kind of delay that area from healing properly, or however long it's supposed to heal. So you want to make sure that you're avoiding this area when you're applying the medication. So as I said earlier, make sure you're avoiding applying this medication to your face, your groin area, or your underarm, except your doctor specifically tells you to apply it to those areas, which is most likely going to come with more instruction regarding how to use it safely and effectively. All right, I hope you were able to enjoy this video. If you did, make sure you give it a thumbs up, and also subscribe to our channel in order to support us here at Demi RX Care. If you have any medication concerns, make sure you reach out to us at DemiRxCare.com. That way you are able to talk to a medication consultant who can be able to answer that urgent question or concerns that you may have. Thank you for watching, and stay blessed.